welcome our next speaker, Dr. Hicks.
First, I want to say thank you, Jocelyn, and thank you, Memorial Hermann, as well as I would like to say thank you for all of your ER doctors joining me to talk about and be educated on a topic that is really important in the medical field. So as you guys might have experienced or heard about, but gender-based medicine is one not only lacking in diversity in therapeutics and treatment options, but also there is a culture around gender and sex-based understanding that tends to not only affect our patients, but also affect our care that we can provide. Being a new graduate, have you found any kind of situation in the ER, in the emergency room, where you've come across a patient that either identified as a different gender, where you haven't been able to treat them, or any type of other gender-based issues along the way?
No.
No? Okay. Well, you're new, as many other of you are, and so this is something that you will probably face in your coming career many years to go. So in all specialties and fields, especially as trauma doctors in emergency rooms, you guys face lots of different diverse types of emergencies and patients, and especially in your field, it's very important for all of you guys to be able to not only help your patient situation in that moment, but be able to help them as a whole. Okay, so first I'm going to kind of talk about some building blocks, and we're going to kind of just talk about, it kind of sounds funny, but basics of gender and sex. So sex, as most people can kind of in the medical field can kind of tell you, is the basics of identifying organisms on their sexual reproductive, their genitalia, their hormones, their DNA. So all of those things, are X and Y chromosomes. Those are kind of things that we identify as what we call biological sex. Here's where we're kind of having difficulties in the medical field with our current cultural movement as a whole. Sometimes you'll notice it's kind of like gone into this path of more of an emotional versus actual scientific biological facts. And that's kind of a dangerous situation to get into because of more ways than just social. So, and I'll kind of explain what I mean by that. So we kind of know what the definition is for sex. So let's talk about gender. So the problem is right now you're having a lot of cultural movements of gender is malleable. It's very fluid. You can pick what gender you identify with, and gender is just a social construct. Why this is a dangerous notion is because it's very narrow-minded. It doesn't address the whole situation. So I brought kind of a fun prop along. So this is, can you tell me what this is, Dr. Jocelyn?
Paintbrush.
A paintbrush, right? So this is a word, right? We picked what this word is. I don't know who named the paintbrush, but whoever named it a paintbrush. We all call it a paintbrush, right?
Yes.
I'm sure other countries maybe call it something different, but here in America we call this a paintbrush. So I'm going to decide that I'm going to change this to the word car. So what do we think of when we think of car?
You can drive it.
You can drive it, right? It's something you get in, it takes you, transport you to where you need. So Dr. Jocelyn, if I give you this car, can you take me to the airport and drop me off after this lecture? No, right? Because words actually have meaning. They have substance to it. So although I might be able to paint a picture of a beautiful car, I cannot change this paintbrush into a car because, as I said, words have meaning. Why that is important? Stay with me. I'll kind of tie this all together in a pretty package, okay? So whenever a woman has a baby, what kind of baby, Dr. Jocelyn, do they have?
Humans.
A human, right? 100 out of 100 times, 100%, they're always going to have a human. Is that correct?
Yes.
So she's never going to give birth to like an airplane or an animal. Is that correct?
Yes.
Right, that'd be kind of weird, you know? So because since the dawn of time, since the dawn of humanity, we've been able to see that every time the human reproduces, what we call the woman and the female gives birth to a little baby human, right? And because of that, mostly every time, there's two types of human babies that we have. We have one with the genitalia, the reproductive systems with testes, a penis, and we decided, when I say we, the person that decided to call a boy, that is what they named it. Then the girl has a different genitalia, a different chromosomal makeup. So the biology of sex is important, foundational substance meaning to the word of gender. So when we try to break the two apart, they can't be, in my professional and personal opinion, it is naive to think that we can separate the two because they are so integrated in the meaning of each other. Now, what I think people are confusing it in is gender identity or gender roles. So that is malleable. As culture and influences change, so does the perceived role of that male and female, right?
Yes.
So that is really important. And the reason I say that's very important for all of you current doctors and future career award winners is because the reason that is when you have patients, let's say that they're born a female and they identify as a male, they look like a male, and when they come into the emergency room, you know that they're a male. Well, men and women present different signs for different diseases, and it's hard to treat a patient if you do not know what the biological sex is. So this, sometimes people want to make out to seem like we are being prejudiced or bigoted, but in the healthcare field, it's very important for you and your colleagues to educate your patients. Let them know that it is a safe space, that is a place that is judgment-free, that you're there just to take care of them. But the reason it's important for you to know what that biological sex is for you to properly treat them. I don't know if you guys all heard, but there has been many cases, I learned this in school, where we've had patients that would have signs of a heart attack. Well, women often present different signs of heart attacks than men, such as in their neck or their back or their jaw, where men typically just feel it in their chest and in their arm, down their arm. So if a man comes in that was born a woman having these pains, it's going to throw the doctor off because they're not going to know. And they're not going to be able to maybe catch or treat that in time. So it is a health risk. Also, given the fact that there was a patient that passed away, was born a female, identifies as a male, the doctors never knew about it, so they never checked for ovaries. This patient developed ovarian cancer. Now, other than those big, major, life-altering situations, men and women behave differently. We have social and cultural constructs that does influence our behaviors as men and women. So it has been proven, as you guys know this, that women are often more susceptible to stress. We're a lot more stressful. Women have a higher rate of depression. We also take different medications for menstruation. So all of those things are important to how we behave, how our brain chemistry is, and how it releases in the concentration of the amount of hormones, how our body responds. So that is important. One area that we're lacking in is the fact that we're not having gender-targeted medication and therapeutics. So being able to treat a female or a male differently for the type of antidepressants or the type of stress, as a doctor, you're going to want to approach that situations in two different ways, okay? So that's why targeting your patient based on gender, delivering plan of care that's specifically for their gender as well as their biological sex is extremely important. And the lack of this type of care is why we're seeing so much disparities, as well as one great area to point out in men and women also approach healthcare different. So a woman will go and get preventative care because women's brain chemistry is different. We have a lot more of that thought process of wanting to prevent. I feel like it's the natural instinction of being a caretaker. Men are more reluctant in their need for prevention care. So this too can also be a difficult situation when a man identifies as a woman, because then that person is going to be more at risk for not taking the preventative care that they need to stay healthy, where they can have we as doctors can catch things early on. So the last point I want to make is educate your patients. One great easy solution I can give all of you to go back to your administration talk about. One solution you can do is start a file when patients are having to fill out a paper of how they identify. Separate it. Have what you identify as and what is your biological sex, your birth biological sex. This way, if you are born a man but you have identified as a woman, we know both of that. We want to know, like, what are your pronouns? How do we make you feel safe and secure and healthy as a person? But we need to treat the whole person. So thank you all for inviting me. It was my pleasure joining all of you guys. I wish the best of luck for everything you guys do. And I hope you invite me back next time.
I will. This was fun. Thank you.
Bye.